Hi, I'm Dr. Rasya from Dr. Dixit Clinic, Bengaluru. All girls go to the parlour to get ready for events. But some simple treatments in a parlour can cause problems which make you look for a quick fix or look for a doctor online. And one of the most frequently asked questions for us is, how do we treat rashes after waxing? And especially waxing sensitive areas like underarms or face. You have to understand that the process of waxing is a process of removal of hair using a mechanical exfoliant where a medicine is applied or a wax is applied on the skin and it's ripped off. And this process of ripping off the hair from its roots actually causes a lot of damage to the hair as well as the skin. And people with sensitive skin, and especially if this mechanism is repeated again and again because one or two hairs are being left behind, it is applied again, a hot wax is applied on the sensitive area as well and it's ripped off again, the area becomes more and more sensitive. And especially because the underarm area undergoes a lot of friction because of the clothing which might be used in this area or because there is a lot of sweating in this area, this becomes a problem for most young people. So first of all, when you are going to do waxing, make sure that you do not go when the hairs are very thin or very short. Make sure that there are adequate length, at least 1 centimeter growth before you go for your waxing. That means at least a 1 month gap between your waxing interval. This allows the wax to be adherent and it comes off in one smooth move instead of repeated application. If all the hairs do not come off in one quick motion and only 1 or 2 hairs are left behind, ask them to do a threading instead of going for another procedure of waxing. The other option is to immediately ask them to ice the area well, and this icing is going to reduce the redness and the inflammation of this area. An application of a lactocalamine based cream can also help soothe this area. So when you are planning for the waxing and the redness, actually a burn happens, then the pain or the inflammation which is happening is not going to subside with the icing or with just the lactocalamine application, and it is going to become persistent and it's going to cause oozing. And in that time, you need to go and see the dermatologist who can probably examine you and maybe have to prescribe a little bit of an antibiotic. So make sure that you're planning even your parlour visits smartly.